We now request Dr. Jitendra Singh, Union Minister of Science and Technology and the Minister in the Prime Minister's Office, Government of India, to address the audience.
Standing before such tall stalwarts, I thought I should appear to be taller. Thank you very much. परम आदरणीय राज्यपाल महोदय और बड़े लंबे समय से हमारे वरिष्ठ नेता भी रहे, हमारे सीनियर भी रहे, संगठन में भी, उसके बाहर भी, सरकार में भी, और व्यक्तिगत तौर पर हमारा मार्गदर्शन भी करते रहे, ऐसे हमारे माननीय थावरचंद गहलोत साहब, हमारे स्वास्थ्य मंत्री जिनका आपने कविता भरा संबोधन अभी सुना, प्रोफेसर बघेल, डॉक्टर सरीन, डॉक्टर जयराम, प्रोफेसर करवंदा, who has also been awarded today, members of the faculty, ladies and gentlemen. I'm glad to be here also because I too happen to be one of those 2,562 members of the NAMS. We don't talk much about it once we are in politics, because if you in politics you talk seriously as a medico, then you are not taken seriously as a politician. And it's also the vice versa. If as a doctor you talk too much politics, then the patient doesn't take you seriously. So you have to learn to draw an optimum balance, but it's been more than 3 decades of a journey. And I must compliment Dr. Singh for having always undertaken new initiatives, innovative initiatives, as he was talking about the Navigate Medicals today. I'll come to that in a moment. But I think it's a pleasant coincidence that we are meeting at a time when the nation is in an upbeat mood. We just had G20, which has been hailed across the world as one of the best hosted G20 meetings. And the world has now accepted India to take the lead in more ways than one. Even in this meeting, we had this International Biofuel Alliance, which is going to have a huge, huge bearing on the medical fraternity as well, and the biomanufacturing area, which is going to be now closely linked to the medical practice as well. And this has also placed, incidentally, Prime Minister Modi as one of the tallest, or maybe the tallest leaders in the world. And this is also the time when the world is celebrating India's science and the Indian scientists, including the medical scientists. And I think the two most striking instances which has happened very recently, without being honest, I would like to share because they are incidentally related to two of the departments that I handle. One of them is the Chandrayaan, and the other the vaccine story. So I don't know how many of us realize that the quantum jump that has enabled Chandrayaan to happen has happened only in the last 4 or 5 years. Because when we started off our space journey, the then Soviet Union and the USA were already on the threshold of landing on the surface of the moon, and we were singing nursery rhymes. And America did land a human being on the surface of the moon in 1969, who made a very famous statement, one small step for man, giant step for mankind. But I was telling some of the American friends the other day, he went around, Neil Armstrong had a stall, but he could not see the presence of water. It was our Chandrayaan which picked up the pictures and the evidence of the water molecules. So that means we had the potential, we had the capabilities, we had the commitment, we had dreams in our eyes, but what was lacking was an enabling milieu, which happened after the arrival of Prime Minister Modi. And why I spoke of Chandrayaan is that space is a department which was till about 4 years back working behind a veil of secrecy. Suddenly it's been opened up to all the stakeholders. So we can't grow beyond where we are today unless we get integrated in a larger way, because we become a part of the global world and our role is also becoming global. When Aditya was launched, we had 10,000 spectators there at the launching site. When Chandrayaan was launched, we had 1,000 media persons at the site of the launching, where earlier on there used to be hardly 10 members of the mission team. So we have opened up to all the private players, to all the stakeholders for a larger collaboration. Same also the vaccine story. I know how much of the medicos here realize, and वैसा बिल्कुल ठीक कह रहे थे, we allowed the prognostic outcomes to decide whether to take treatment or not. Usually, when you are taught medicine, you are taught about prognosis after the treatment. Here, the prognosis proceeded. कि 3 दिन के बाद ठीक हो गया तो ठीक है, नहीं जाएंगे डॉक्टर के पास उसके बाद. So it's the other way around. So a country which was hardly known, because it's not that we didn't have health as a priority in the government sector, of course, which happened after Prime Minister Modi came in, but even in our social life, health never enjoyed a very high priority. And there were also certain economic constraints for it, because a nation which was not able to actually fend for itself the daily meal could not always think of going in for life, particularly the specialty that I deal with, diabetes, mellitus, endocrinology. We have patients who make a calendar, missing drug 2 days a week, or oral antidiabetics 5 days in a month. और कोई resident बैठा हुआ साथ में डांटता है कि अगर दवाई नहीं खानी थी तो आए के hospital. Then I would call him and tell him, look here, this is this poor man's self-respect. And he doesn't want to acknowledge that he can't afford it. But that's how it happens. So we had certain reasons we could not give health much of a priority. But the same country today, which was not much known seriously for therapeutic health, is today acknowledged as a leader in preventive health care, because we are the ones who have given the first DNA vaccine for COVID to the world. So that speaks of the kind of talent that we have. It's just that the compatible milieu, the compatible ecosystem had to be provided. And it's become possible because of the sportive indulgence at the level of the policy planners, at the level of the political leadership. As Professor Waghel Saab was saying, Ayushman Bharat. I mean, there are a number of initiatives taken by this government, which could have been taken earlier also. आपने उसके गुण गुनवाए. Lekin as medicos, in addition, I would say the most striking feature of Ayushman Bharat is possibly this is the only health insurance scheme in the world where you can get insured for a pre-existing disease. You detect having developed a malignancy today, tomorrow you get insured and get paid. No other insurance company, even if you suffer from a myocardial infarction, you go for a claim, they try their best to convince you that you have camouflaged the disease. You already had an underlying coronary disease, which you are not, and somehow they manage not to give you the benefit that is due to you. So this is such a scheme with such a huge degree. So each of the Modi schemes has been planned with a huge degree of sensitivity. Now this vaccine success story was possible because Prime Minister formulated a special scheme, dedicated scheme called Mission Suraksha. And now we have the new medical devices policy. We are among the 5 top healthcare manufacturers and devices. Again, that institute is also being dealt by me, the Chitra Institute in Trivandrum. We are actually exporting devices at a much cost-effective price. So we are among the 5 top, but the least cost. And we are now looking up to $550 million in the next few years. And this has been possible because new schemes have been rolled in, like the policy for the promotion and innovation of pharma, etc. And therefore, the role of NAMS also has to reorient, as was indicated when Dr. Sareen, I appreciated when he mentioned Navigate. NAMS was born in early 60s, and NAMS or NAMS has been a part of the journey or the evolution of medical education in India. And when NAMS was born, it was not easy to get a post-graduation seat. We had very few government medical colleges. Private medical colleges were totally unheard of. I mean, it was beyond imagination. Even when my first medical college, of course, this Ramaiya became much later. Earlier it was an engineering college. Even when I was a medico, we had this Ramaiya as an engineering but not medical. So medical in private sector education was not known. In government sector, you had very few. Post-graduation seats still fewer. So where do we go then? And therefore we had diplomas, that too you couldn't be very choosy. And I think NAMS came as a very good platform, an alternative to train our young medicos. I very vividly remember when I passed out of my MBBS, one of my seniors said, "Saab MD to milegi nahi, koi diploma वगैरह कर लो." So my guide told me he could manage one DTCD, tuberculosis. So I went back to the hostel the whole night. I didn't sleep. I was waiting for the sunrise to go back and tell him, because if I go back to my village, they would say TB ka doctor aaya. It was such a, antagonistic world that I thought the people would stop engaging with me. That was the kind of the social thinking. Finally, of course, I did my medicine somewhere else, MD medicine, and then, of course, endocrinology, whatever. I mean, I don't want to get into my autobiography, so that's not the story. What I'm trying is that I belong to a generation which has seen the transition from those primitive times, because when we came in, the generation of the independence times was on its way out, but the legacy was us. We had our internship training in the sanatoria. Now, if you talk to young medicos about sanatoria, they'll ask you, what is that? Because you don't no longer have such kind of communicable and tropical diseases. When we were undergraduate medicos, I think hardly ultrasound was there. The CT scan came in only when we were postgraduate medical residents. And the list of the surgery, if you had 10 patients, at least 2 would be what is known as exploratory laparotomy. If you today indulge, you will get sued. What was that? You cut open the abdomen to see what is inside. The present generation medicos would not have heard of it. It was a very common term those days, because even ultrasound was not available. You had those X-ray abdomen, and through you could see the levels of fluid and this, that, and make some vague guesses. And suppose you had a hard nodule here, how do you make out whether it's a ileocecal tuberculosis or it's a malignancy in evolution? So you cut it open. Feel it with the palpation, see it with the naked eye, and then close it if there's nothing. So now with the kind of, why I am saying so is that today we are not only much ahead of that, we are at pace with any other advanced country of the world. As I said, we are cost effective, we are highest manufacturers. And the best example again, because that again was ruled out by me only, the mission quantum technology. We rolled out in March this year. So quantum technology is going to be a huge revolution in area of the medicine as well. We have already installed one machine in Mohali, the Tata Satellite Hospital, where the radiation beam virtually moves with the movement of the lung or the movement of the gallbladder to catch the exact point. But the quantum is going to be a game changer. But why I'm saying is that we are among the 7 countries in the world which are into R&D stage of quantum, not yet applied. And see the contrast. As medicals, we have been taught to talk in terms of statistics, evidence, and comparative trials. So when you do the comparative, you'll go back when the technologies took about a decade and a half to arrive in India. In 1970s, Houston became a very famous name in India because those who were wealthy could go there to have a cardiac bypass. Now you have a small age, walk into a corporate hospital, come back with 2-3 stunts inside. And the television happened in America in 1950s. It was a popular household item. And 1960, in fact, the debate that decided the presidential election when Nixon lost to John Kennedy was determined by a TV debate. Over here, we did not know what is TV, what is debate. That came here only in 1970s. And that too in the form of a small chitra. And South India, I remember in 1970, because I have lived all over the country. South India, I think the first time we had one small test match telecast from Chepak, Chennai, then Madras, somewhere in 1975. Bangalore, not even that. Whereas today, we are at par, we are at the same pace as any other country in the world. So we are actually now in a position where the world is looking up to be led by us, we are ready to lead. Now the idea is to provide accessible, affordable medical care, and also to be able to provide medicos in a scale which is accessible. Because now I was in Northeast for 7 years, we have a huge prevalence of head and neck malignancies over there. Now, you can't have an oncologist in every hospital or every district hospital, but we made chartered our plan, we would have one. And I think that is where these bodies like NAMS, Dr. Serene can come in. In Northeast, we had a very high evidence of head and neck malignancies. But you can't have so many oncologists. We decided upon a plan to have one oncologist every district. So what we did, I mean, that time we didn't have much of a telemedicine or this Navigate thing which you are talking, which is now a substitute for that. We entered into a kind of an understanding with RDR Cancer Institute, Madras. Incidentally, Dr. Hemant Raj there was my classmate from Stanley. So we chose from each district, each state, one surgeon, one physician, 6 months each training. So you have to create a whole genre of doctors who could cater to the emerging spectrum of diseases in the country, because there is virtual universalization. For example, type 2 diabetes mellitus is known to be a disease of the South India, never in the North. It's no longer so now. And some of the diseases which were known to be in India and not known otherwise are also now, I said, we have total democratization of the disease spectrum all across the country. The other day, there was a group of German medicos, they wanted to undertake a research project. They said, what would you suggest, which area? I said, you tell me the disease and I give you one. We have such a huge pool. And now the artificial intelligence taking over, Navigate taking over. I think there it is where the NAMS can actually step in, and the government can also collaborate in doing that, because we have to prepare for the next 25 years. The Prime Minister keeps saying Amrit Kal. But we don't know what it will be, because we, as a normal human being, we tend to look at that 2047 through the prism of 2023, which is not so. You go back, you go to bed in the night thinking what will happen in the morning, it would have already happened by the midnight. And again, when you do undertake a research project or a thesis, you have a retrospective. So if you actually want to understand what I mean, go back 25 years from today. Go back to 1998. What was new? One of the examples was that video recording, VCR. No dowry would be complete without that. Today, if that is put in the dowry, the mother-in-law will throw it out of the window. And what was new in 1998? STD booths, because you didn't have these mobiles and they just step in. और नेताओं के घर के बाहर भीड़ लगती थी कार्यकर्ता की, सर, कि एक एसटीडी का बूथ दे दीजिए, बेटे की जिंदगी बन जाएगी. जब तक बेटा बड़ा हुआ, एसटीडी बूथ बंद हो गया. ये कहानी है 25 साल की. So जब अगला 25 साल आप देखते हैं, तो so many imponderables. But one thing would remain common is that India is going to take a pedestal role, a leading role, and we have the dividend of population. On the one hand, we have 70% population below the age of 40. On the other hand, the elders are also refusing to quit. ऐसा भी नहीं वो कम हो गए. The total number of elder citizens about 60 is also increasing. The lifespan is also increasing. At the time of independence, our life span was just about 55 or 50, not even 50. So how best to put that force to use? So NAMS will have to actually address itself at two levels. A, the elders are looked after without becoming a liability on the society. You'll have to devise mechanisms, whether it's the palm of the nursing workers, the nursing specialists, the household medico practitioners or the health providers. And B, how best to prevent the happening of disease at the younger age group. Because when you have more than 70% below the age of 40, you will also realize that you have the disease of the middle age happening in the young age. You have type 2 diabetes mellitus in the young. You have myocardial infarction in the young. So how can you allow the energies which are to be put to the nation building to be squandered away by these diseases? So I think there's a huge, huge role now, because sometimes why I'm saying so is, which Dr. Serene may not say, is that very often it is said कि अब NAMS की ज़रूरत क्या रही? अब तो MD भी आ गई, DM भी आ गया. अब ये उनके लोगों के लिए जिनको MD नहीं मिलती, जो 5, 7, 8 डिग्रियां लिख लेते हैं अपने बोर्ड के ऊपर. जब when you don't have a single big degree, you write 5, 6 degrees. Because I have gone through the whole rut, so I can understand. So this is the answer which I am giving you. Because the changing requirements of health, the scale of health requirement which is needed in this country. Because otherwise, when NAMS was born, the the health scenario, medical education scenario was quite deficient. It's not so now. अभी तो आप ज़्यादा डिग्री लिखते हैं, आप देखिए जिसने सिर्फ MBBS किया होता है वो 5, 7, 8 नीचे लाइनें लिखता है. MRSH लंदन, फिर MRSH जर्मनी, गे कहीं भी नहीं होते. But that is not so. We have to make ourselves understand. We have to reorient ourselves, and our role is increasingly becoming more and more important because we cannot provide, we are still not providing enough number of beds, enough number of doctors. And so we could at least provide a respectable health care, and if we are able to focus on the prevention of disease, I think that is another area which NAMS could take up. Preventive health care doctors, purely specializing in preventive health care. So if we could do that, we would not only be serving the cause of health care or medical care, we would be actually serving a national responsibility by preserving the energies of that huge youth resource pool, which is going to be the architect of 2047 India. Thank you. Usually we are expected to light the lamp as ministers, but since I have been a faculty member for more than 30 years, the habit doesn't go back, sorry.